What will it look like to have COVID under control, with quotes? Just as after 9/11 there was a new normal, what can we expect a post-pandemic America to look like?
Uh, one thing I am very concerned about is the unemployment, of course, the people who've lost their jobs.
Yeah.
A lot of those jobs aren't going to come back. And I am concerned about the future of work. And we have to do a lot of thinking about how to sustain people. We're in a horrible, horrible recession that's in danger of being a depression. And even once we get our hands around this, and we should be able to do it by doing the very things that Mary and I were talking about. I mean, it's not brain science. It's just that this guy, Trump, cannot admit that he made a mistake. So he hasn't adjusted at all, and he's invested in all the wrong things here. What I worry about is that post-COVID, and look, this has really laid bare so many of our problems in this country. One of which is these disparities in healthcare, but also economic disparities, which is one of the root causes of disparities in health and in healthcare, obviously. And Biden, when your opponent is digging himself a hole, you let him dig. And Trump has been digging himself a hole, but Biden's got to come out and talk about what he wants to do. And the good news about that is what he wants to do is what the American people want. They want to build on the Affordable Care Act. They want to address this horrible income and wealth disparities. I was talking to Chris Rock the other day, and he said to me, we were talking about wealth disparities, and the Spotlight people at the Boston Globe, the ones who revealed the priest pedophilia, did a thing on the net worth of people in the Boston area by race. The average net worth of white family in Boston, $247,000. The average net worth of a black family in the Boston area, $8.
Yeah.
And it's going to be negative after COVID. It's going to be negative.
And that was redlining.
Yeah.
That was homeownership.
Exactly. It was redlining right after World War II. You had the GI Bill. Our soldiers came back. That's exactly. They came back. You could buy a home. That's where you start building your wealth. They were redlined, and banks would not loan to people to African Americans in redline in those areas, and that's how you build your wealth.
That's right. Stunning.
You hit it on the nose.
Yeah.
Go ahead, Mary.
No, I just think that I just want to echo that we started out with all these numbers. The United States is reporting nearly a quarter of the global disease number of global deaths from COVID-19. Now, these may or may not be complete even for the United States, but we're under 5% of the global population. So this really should make us all very worried. And it hasn't totally been incompetence, although that's been part of it. It's also the underlying vulnerabilities that we have by having a society that is divided determinedly by race, not just in urban areas, but in suburban areas and rural areas. somebody put up the New York Times piece. And that, that showed that. And one in which income inequality has simply escalated to phenomenal levels, where three people whose names we all know control the amount of wealth that that is accounted for by about half of the population of the world. I mean, so this is not a stable situation,
Right.
and we're seeing how it's cost us. So there's a chance for change. I hope. I hope for ourselves and for our children.
I hope so too.
Yeah, let me briefly add, Vivian, from a health perspective, I hear a lot of discussions from various folks about how people are, first of all, staying home and not going into the emergency room when they need care for things like what may be strokes or maybe heart attacks, but also it's having a ripple effect on preventive care and getting vaccinations. So we may see an uptick in the number of measles cases across the country of kids who are not getting vaccinated. I was just listening to George Benjamin, the head of the American Public Health Association, just yesterday on this very point.